changes nightwear 3 times a night, the entire list. She just started a different protocol, Wiley, but didn't like it. And she wants to know what your thoughts are for ablation and HRT, and also the products that you offer.
Okay, so that's a loaded question.
And she's
Let's see
got a
what
little bit more
yeah,
questions there.
I love, okay, so Paige, you are a woman stealing my heart because you are a woman of question. And you know what? I'll tell you why I love this, because not everybody can think of questions, but that doesn't mean they don't have them. When I was in med school, I was one of those people. Go figure. But I remember sitting in class and, you know, professors giving us an opportunity to ask questions, and I would be like, can't think of anything right now, but when I get home I have lots of questions. So when people spoke up and had questions, I benefited from that. So yay for all of those who can think of them on the spot, right? That's not always easy. So ablation, how do I feel about ablation and HRT? Okay, so ablation is when someone, I'm going to reach over here and get I'm in my office in Trenton, and I'm going to reach over here. Let's see, I'm slowing my connect. Stop my picture.
When you're sharing.
When I'm sharing, stop my picture. Okay, so my husband just came in. I'm in my office, and he gave me this little note because he's so sweet. He looks after me. He looks after all of us, ladies. He looks after all of us. So when I get mad at him, you should spank me, because I should never get mad at this man, because he's really out there to help us. He says, need to stop your video. It's slowing your connection when you're sharing. Okay, so I'm not sharing my screen now, so we'll see how that works. I want to reach over here and get my uterus. Not my uterus, but a uterus. Hold on. I am reaching over to get my uterus. Okay. I have some interesting things. Ah! Okay, so this is the poop shooter, and this is the uterus. See that nice, strong muscle that uterus has? Look at that. Now this is the bladder. So you can see the opening of the urethra is right next to the opening of the vagina, which is right next to the I mean, these three holes, I mean, really are side by side. And this is one of the reasons we often can get urinary tract infections, especially after menopause, because when this bad boy starts drying up, you see these little fat pad, this yellow stuff. This is the front of your body, and this is the back. And you know, this here, you might have noticed that even your outer lips change, because the outer ones, you know, the ones that used to be puffy, these change because our fat pad changes. We can sometimes get more fat here and less fat here around our lips. Now what happens is, as this gets drier, it starts to, kind of retract a little. And this urethra gets closer to the vagina, and which also gets closer to this. So, you know, this has higher risk of infection. I mean, this one has higher risk of infection. This one does too, but this was never meant to be sterile, right? That was never meant to be sterile. Men's penis is not sterile, right? So go sterilize your penis or you don't get any. No, that doesn't happen. So that's why we can get more. Well, ablation is when a gynecologist goes in with a tool and actually removes overgrowth of uterine lining. Okay, so this lining is a normal size, but if people have, usually from estrogen dominance, because estrogen is going to increase our growth of this uterine lining, and progesterone is going to decrease this growth. So, you know, we hit around 40-ish, and our estrogen in proportion to our progesterone is higher. So that's called estrogen dominance. And it's not that estrogen is higher. The truth is that progesterone is lower. And that's why we call it estrogen dominance. So that can slowly cause this bad boy to get thicker and thicker and thicker and thicker. That can cause spotting, that can cause very heavy periods, cramping, heavy periods, bloating. It can affect, because this colon continues up and it's, you've got this big, colon, all this stuff is really tight together. So it can even cause constipation. It can cause diarrhea too, by the way. It can cause diarrhea. So it can do either one. It irritates the nerves that take care of everything else in here. So the ovary is over here. So that's one of the ovaries. This is just a cross section. So when they go in and they ablate this, meaning, remove this lining, not all of it, but of course, because if they remove it all, then you will actually bleed, because inside here is lots and lots of blood vessels, as you can imagine. I mean, we're full of juicy blood vessels in here to feed that wonderful uterus to carry our babies. We're just amazing. That's what we are. We're just freaking amazing. So in any event, when they do that, you generally, most women stop having periods. So when that happens, you stop having periods, you don't know if you're going through menopause until you get symptoms like Paige is talking about. So if Paige is not having periods anymore, it's because she had the ablation. And also, as the ablation can last, I've seen ablations last as long as 10 years, but in young women who have had to get ablations early. But, estrogen dominance can happen even before 40. It can happen. I see it happening younger and younger and younger. And in fact, the women who are following women's midlife specialists now are getting younger and younger. When I started it was pretty much the average age was 50. Now we're seeing people following us that are 35. So that's interesting. Now, why is that? That's a whole nother topic, and I have a whole answer on that. But in any event, to stay focused on Paige and get through all of you guys, and I tend to just want to answer everything because I think this is so interesting. She may not be having periods, but she's having severe hot flashes, and she's having to change her pajamas or whatever she wears 3 times a night because she's sweating. So the entire list. So that entire list probably includes irritability. It may include some bowel changes with bloating. It may be hair changes, thinning of the hair, irritability. You guys know the symptoms. They can be frustrating. Insomnia is a huge one because of the progesterone, lack of progesterone. In any event, she started a Wiley protocol. And so a Wiley protocol is with bioidentical hormones, but it's on a certain date. It's a Wiley protocol if I know correctly. And Paige, what I'd like you to do is tickety tick tick tick, a little chat in there. Is the Wiley protocol that you're talking about? Are you talking about the one that has you taking a certain amount of bioidentical hormones at different times of the month? Is that what you're talking about? And so I'm going to wait for her to say that, but she doesn't like it. So I want to hear. I want her to tell us in her message box. And Yvonne, when it comes up, just give me a shout out, just interrupt me. But so what are my thoughts on ablation HRT? So if you don't know if you've gone through menopause, because of ablation, there's a couple things that you can do. You can still test your hormones. Okay. You can always still test your hormones because ablation is not going to affect your levels of hormones. So you can still test your hormones. Now, if you've never tested your hormones before, you can do it by blood because blood is going to give you your baseline. If you plan to take hormones after that or use hormones after that, topical, you only want to use topical. We know that that's another subject, but you might want to consider instead doing saliva, because saliva is going to give you a baseline that you can then look at. Now, why saliva? Even functional medicine doctors screw this up. Even functional medicine doctors who have the same degree as I do from American Academy of Anti-Aging, they don't want to ask their patients to do it because they don't want to explain it to them. And it's so simple. It's this: the hormones that you use topically are not, they do not travel in the blood. They are sitting in two places. They are sitting in your fat cells, number one, and as your body, as your cells request it, it's transferred through the lymphatic system. And that's why a blood spot is even better, because I don't like it as much as saliva, but I would prefer you to do a blood spot than venous blood, because the venous blood is really not accurate. It's not, it's all over the place. And every doctor will admit that is true. It's all over the place. They'll say, oh, you don't even need to test your hormones because it's all over the place. That's true if they're testing this way. But it's not all over the place if you do saliva, because saliva is measuring what is more in the tissue level. I know it's a hassle. I know it's a bummer. If you're past 65 and you have Medicare, ZRT does cover, it is covered by Medicare. So at least that.
Dr. Karen, we do have a reply back from Paige.
Yes.
And she says yes. She says increase, she just put E, so estrogen, and then add progesterone. So it mimics a cycle of a young female.
Yeah. So that's what I was thinking, but I just wanted to make sure, Paige. Okay, so one of the reasons, so you can test your hormones. Thank you, Yvonne, and thank you, Paige. One of the reasons people don't like Wiley is because of one of the reasons people love postmenopause. Balance. It's hard enough to be a woman. I mean, we see things differently than men, right? I mean, we see things from a level, a mountain. We're standing up here looking down at the valley. And that's our family. That's our home. We're seeing what's happening down here. And so our brain is thinking about a million different things at once. So then you go and add the normal fluctuating hormones of a young woman. It's even harder. I remember when I was in college, and I told my husband this, and he said, gosh, I feel sorry for you. That's horrible. But I remember walking, passing students, fellow students, passing them on campus. And when I was close to my period, I always knew when I was close to my period, because they would smile. People are nice, and they would smile. And you know what I would think? You know what I would think when I was like a day or two away from my period? I'd be like, what are you smiling about? Hmm? I love the balance. I wouldn't do a cycle, period. I wouldn't do a cycle because I like balanced hormones. However, the Wiley protocol people, the people who support that, feel that that's a healthier way to go, because they say, well, that's a normal woman's, that's the way a woman's cycle is. So, I mean, you can do that with our hormones. And I actually have a protocol for that. You use one pump this time of the month, you use 2 pumps this time of the month, you use 1 pump twice a day this time of the month. I mean, you can do all of the Wiley protocol with this, but it's just that most women, the thing that they like about menopause is that they don't have as many ups and downs. The Wiley protocol also increases the risk of bleeding. So when you're cycling, you're bringing your hormones up and then you're staying at a level. So you bring them up slowly or until around day 15 or 14, and then you keep them at a stable level, and then you stop. That sheds the uterine lining. And Paige wouldn't experience that because she had an ablation, and her ablation is still active. It hasn't regrown. And it may not regrow because it sounds like she's postmenopause, so her estrogen is going to be lower. So, so also products offer, are they yes, our products are EP ratio correct. For, I would say, 95% of the women that I've cared for. I used to write prescriptions for all compounded um, hormones. I did that all the way up until we came out with Young Hormones. And I don't even remember when we came out with it. I think it was 3 years ago. Yvonne might remember, but I think it's been 3 years in June that we came out with Young Hormones. And basically 95% of the prescriptions that I wrote were low dose over the counter doses. So women really need a lot less hormones than they think. If they start on if they start on the synthetic hormones, it can be more difficult because those are so strong. The synthetic estradiol that comes, uh, especially if they take a pill, which is even stronger, um, that has a very high conversion in the liver to estrone, E1. And that estrone um, is a very strong estrogen. And what happens is the cells get used to that. So I'm looking up at a cell that I made out of Legos one time. I'm looking at, boy, that'd be nice to show right now. I didn't even think about stuff. But in any event, the cells make receptor sites based on how much of something they have in the body. So if you have a lot of something, the cells are going to make more receptor sites to accommodate that hormone. So if you have a lot, or you have a lot of estrone, we don't want, as it puts you at a higher risk of breast cancer, estrone. And estrone binds to a certain receptor. It binds to something called the alpha receptor, not the beta receptor. And so your cells will make more estrone receptor sites, alpha receptor sites. And when it does that, and then you suddenly get off of that and go onto bioidentical, either mostly estriol, E3, well, then you'll have hot flashes and you'll have a harder time. And it does take some time. People who took oral contraceptive pills, the same problem, because oral contraceptive pills are a very strong estrogen. But on top of that, they have a synthetic progestin, excuse me. So they have a synthetic progestin. So I have a protocol for that as well, how to get off of, as you're reaching that time in your life, how to get off of that and move. So you don't need the birth control anymore. I wish people didn't really use that. We know that they have higher rates of breast cancer. But in any event, I don't want to, nobody's asking that question, so let's save that for another day. But yes. What's that, honey?
Well, are you ready for the next question?
Yes, and thank you. You're pushing me along. You see, guys, how Yvonne is so good for me. I'm ready, honey.
We're going to help Lisa. She's got a question about libido. So she
Okay.
wants to know when her libido come back. She's been using hormones for about 6 months now, so she might want to tell us which hormones, but 6 months, and she wants to know when her libido will come back.
Lisa, that is such a great question, because libido is really low in a lot of women, and not just women who have low hormones either. If you have low hormones, it's a double whammy. I mean, you're really, depleted. But libido is a very complicated thing for women. Men can turn on and off their desire for sex. Can they turn it off? Harder for them to turn it off, whereas women have a harder time turning it on. Now, libido has been studied extensively, libido all by itself. And what has been identified with libido is that estrogen and testosterone and progesterone, our sex hormones, are only one thing that affects our libido. So you can replenish your levels and still have low libido. I have an entire Yvonne, I just thought of a great giveaway. You know, we want to, by the way, we have something to give to you at the end of this. We have something great to give to you at the end of this. I told you there's going to be free gifts. There's going to be a free gift for everything. You, you take care of yourself. I take care of you. I help take care of you. So we have something that I wrote, many years ago. I think it's many years ago, like 2012. So we're gonna give that out to everybody that's on here today. Okay, so libido. This is another great gift we can give. I've got a 3-hour hot, awesome, and I mean sizzling hot, fun. I could do it live, which would be fun. Webinar on libido and how to bring back your libido, because our sex hormones are only one thing. And if your hormones rise and you are and normalize, and you're finding that your libido is still low, then you need to look what I find to be probably the second most likely thing. Actually, the sex hormones, people think that testosterone is the number one. It's actually estrogen. So the way testosterone drives men, estrogen drives women. So our estrogen makes us who we are, that loving kind of, let's put, everybody up under our wings and take care of them. And their testosterone makes them want to protect us in a strong way. We want to protect in a emotional, loving way, and they want to protect from their testosterone speaking in a strong, strength wise way. Even though women can come out with their daggers if they need to, right? Bam, bam, we can. It's probably still the estrogen driving. Well, estrogen, they have found, is actually still, by supplementing women with testosterone or DHEA that can partially convert to testosterone, is not as strong as supplementing with estrogen. So I have had women on extremely high doses of testosterone based on their convincing me that this is the only thing that will work for them. And I have done it for them. And because if I don't, the way I figure is if I don't, then nobody else is helping them. So as long as I follow them very, very closely, I'm, feel like I'm doing what I was supposed to do. And it's very hard for them to even notice a difference in their libido, if even at very high doses of testosterone. There is
Oh,
what's that, honey?
go ahead. I didn't want to interrupt.
There is this, you can get, um, um, testosterone by pellets, and I see more problems with pellet testosterone than help. So a lot of women, because once you put the pellet in, you can't stop it. You can't take it back out. And anybody that does pellets ought to do topical first of testosterone, not DHEA, but real testosterone. And the reason that they should is because they need to know the dose that makes them feel the way they want to feel. Because once you put that pellet in, they tend to use very high doses. Once you put it in, you can't take it out. And a lot of women get angry and their hair falls out, and then they get stressed, and then their cortisol goes up. And the last thing that's going to happen is an increased libido. So cortisol, I want to just tell you one thing about our sex drive that has been so carefully studied. So the woman's sex drive is really up here before it is in the blood of hormone levels. So does cortisol decrease sex drive? You bet. Cortisol, and right now with feeling stressed, if you're feeling stressed, you're not going to want, think about it, ladies. There's not a lot of people who want sex if they're feeling stressed. Now, there are some people, though I do have to say, there are some people, it's a smaller percentage, and these people are probably lucky, that actually have increased sex drive when they're stressed. That is the way they deal with it. That's great, wonderful. But for most of us, that's not the case. So the studies the best way to define it, to describe what we know about sex drive, is that it it's about what pushes the accelerator to us wanting sex, and okay, so let's say this is the accelerator and this is the brake, like in a car. And what pushes the accelerator to make you want more, and what lifts off the brake to make you want more. And every single person's accelerator and brake is different. And this is pure science. I've just love studying this because there are a lot of sex therapists and researchers out there, and boy, they're doing good work, because this is a problem for couples or individuals. So what pushes the accelerator for me, I'll just share, is my hubby doing sweet things for me. The other thing that pushes the accelerator for me is when he makes me laugh. So this makes me like, oh, honey, let's go do it. But what lifts off the brake is hormones, decreasing my stress, because stress always has my brake on, always. If I've got things that I'm thinking about or things that are on my list to do, my brake is on, period. But if that is lifted, if I can decrease my stress, if I can decrease, I mean, we're on a cruise, man. I'm like, yeah, come on, honey, let's go for it. So then you massage my feet. Oh boy, yeah. So the key, Lisa, if your hormones are okay, don't fret. Think about it in this sense. And 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 it's a communication with your partner. So you can say to your partner, my libido's low and my hormones are normal. I checked them. I've been using these hormones for 6 months. They're After 3 months of using them, you're going to be stable in that dose. And if you use 2 pumps twice a day, it's very, very likely that they're going to be at least low normal. Okay. So low to medium normal. And that's the truth. 2 pumps twice a day. Now, there are some of you that need a little bit more. If you're really, really thin, you don't produce a lot of hormones yourself, because fat cells produce estrone. Estrone is converted to estradiol. So if you're thin, you might need 3 pumps twice a day. Some people need 4 pumps twice a day. It's a rarity, true rarity. So you tell your hubby or you tell your partner, you tell them, honey, I feel like my hormones are fine, but my libido is still low. And so I need to discover what turns me on, and I need to discover what turns me off, and I've got to stop that. So there are certain things that turn women off too, right? That brake is going to be on there all the time. Like, for instance, guy not doing a share in the household, right? A guy that doesn't help you in the household, doesn't help you cook, doesn't offer to cook, or doesn't offer to do the dishes after you've cooked. I mean, that's kind of a break, right? Even though we are loving and we want to be that way, we still want help, right? And it's still a mutual thing. If your partner is busy and he normally takes out the garbage, you're going to take out the garbage. So these are the things in the communications. And Lisa, I hope that helped a little bit. I will, Yvonne and I will talk about our live, maybe doing our live 3-hour virtual. It's actually a half-day virtual conference that is really cool, that we give now and then, that we have for sale. But maybe we should give that away right now.
That would be awesome. It's an awesome program. That's exciting. Yep.
Okay. All right.
I've got a little bit more from Lisa, which you kind of answered. She is very slender. And so Hormone Heaven is 3 pumps twice a day.
Is what she's on right now.
Right. And she also needs to test again, is what she's thinking, and asking questions about ZRT. And DHEA Power 2 pumps once a day. And she's also having a discussion here with Shelly about Happy Hoo Hoo. She is on that, takes it every other day. She says it does help with vaginal dryness.
Great. Yeah, I agree. I would retest. You've been doing it for 6 months, haven't tested since you've been doing it for 6 months. I'd say that's your first thing. Make sure your hormones are okay. And then we'll get this cool, it's a really cool webinar too. The one thing that we didn't do last time that I want to do this time, Yvonne, is I want that music in there. Because
Absolutely.
okay, how about I'm just going down the list. I see I have control. Can I read that? Can I read one?
Yeah, absolutely.
I have controlled type 2 diabetes using one med. Am I at higher risk for a bad outcome for COVID risk? That was from Diane. And yes, as I was saying before, honey, controlled diabetes, truly controlled diabetes, actually, if it's controlled and it's been controlled, is puts you at a little higher risk, but not anything like those who are uncontrolled. And just getting into the conventional side of medicine. Controlled is usually considered by a person's hemoglobin A1C, which is the average blood sugar over the last 3 months. What controlled to functional medicine is not really that, because you can have, let's say, a blood sugar of 180, 200, and then you could have a blood sugar of 60, and then your average will be here. So it will make you look better than you are. So I recommend everyone who's looking at their blood sugar to always check, double check, not just your fasting and not just before your meal, but every now and then, especially when you eat a higher glycemic meal, is to check your blood sugar 30 minutes after you've consumed that meal and 2 hours after you've consumed that meal. That's going to give you a true picture. Now, there's also another test that you can do that will show whether or not you have spiked a blood sugar over 180 in the last 3 weeks. Now that test is through Cleveland Heart Clinic. We're about to put those labs on our website. Those, we wanted to, we were about to, but then all of this happened. So why tease people when they can't really go out and get it? So we've held back from putting it on our website, but we've partnered with Cleveland Health Clinic and to offer these labs to you, where you can just purchase them, go to Quest, get your labs, and they'll come back. Now, here's the cool thing about this. Number one, we're going to offer a huge discount. So people who really want this can go do it. The second thing is Cleveland Health Clinic, they will give you 6 months of free counseling. First, they'll give you like an hour of counseling to go over the whole labs. This is our Cleveland Heart Clinic, right? Cleveland Heart Clinic, amazing. I love that place. It's the #1 heart center. And women's midlife specialists, I love doing hormones and gut health and all of that, but I truly, truly love all of medicine. And I want to help people do what they want to, stay well above and beyond hormones. Hormones are one thing that help keep us stronger, but there's so many other things too, like our blood sugar. So let's see, I just got a note from my beautiful husband, and who said that, let me find Yvonne again. I accidentally muted her, and I didn't mean to.
I'm
Sorry.
back.
Oh, sorry, Yvonne. He said, you accidentally muted Yvonne. So I'm not touching anything. So in any event, Cleveland Heart Labs is a way to do it. Now, so they will give you a free review. They will go over all your stuff. So I don't have to do it. This is really, really important because I don't really have the time. I want to give as much as I can away. You know, we have another business, that's it. And we have Young Hormones. We sell products. So it's not like I'm giving, you don't have to say, oh, thank you. Oh, that's so wonderful. And all that. I mean, the people who buy my products, I'm grateful to you. It helps me, survive. And I don't have a lot of fancy stuff, and I'm not that kind of person. But I want to reach people, and I want to help people because that's what I was meant to do. So Cleveland Heart Labs, that's one of the things that I'm going to highly recommend when we get it on the maybe we should start getting that stuff on. Maybe people will. Oh no, because you can't really go to Quest Labs. So you can't go get your labs done right now. You can't go to Quest Labs for anything that's not urgent. So it's just a teaser and we don't want to do that. So then they'll give you 6 months of counseling on what to do to improve those labs. So watch out for that stuff. When we're kind of done with this COVID stuff, be watching for that opportunity.
Amazing opportunity. That's awesome.
I know, I'm excited.
We
Okay.
have a couple questions from Rhonda, so I'm going to split them up.
Yeah, that sounds good.
Okay, her first question is, how is this coronavirus more contagious than the other flu?
Oh, that's such a good question. Well, there is something called herd immunity. And herd immunity is when people, like a herd, are immune to something because they've already had it before. Well, this frickin' virus is brand new, brand new. Nobody ever had it before. So there wasn't a single soul on the planet that had a single bit of immunity for it. So it just spread like wildfire. And that is the main reason. Now we're seeing that the mortality rate is actually going to be closer to 0.6%. And I'm going to tell you why that's also more important. It's not more contagious. That's the mortality. So that's the other reason it's more dangerous. So the seasonal flu, a lot of people, it's a seasonal flu. A lot of people have already been exposed to it. We guess, epidemiologists follow all the different flus that are out there in the world, and they're looking at all the different viruses that are causing the seasonal flu, and they look at what is in different regions, and they say, okay, this year it looks like the seasonal flu is going to be this one, and so they come up with a vaccine for that, right? And that vaccine either people take or they don't take, and then that gives them immunity to that particular one. Or they get the flu and they get immune to that particular one. Now, we don't know how long, but exactly, we don't know how long someone is immune to that particular one, but it seems to cover you. And I don't know if you've noticed, but when we were younger and we were raising our children, often we got all the illnesses that our kids brought home. And we were sick as much as they were in kindergarten, right? Or elementary school. And then we started getting less and less, right? As long as we took care of ourselves, it seemed like we were getting less sick. And then as we get older or get comorbid conditions like diabetes or heart disease or obesity, then we start getting our infections back again because our immune system is no longer strong. Or if you're malnourished, and when malnourished you can be obese and be malnourished. In fact, many people who are obese are malnourished because they're not eating the foods that nourish them, and their body's begging them to eat more because they're malnourished. So the body is saying, eat, 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 eat. My body doesn't say that. My body doesn't tell me to eat except at normal times because I'm very well nourished. But I could be sitting next to an obese person that is starving, right? Because they're eating the wrong foods or they don't have a healthy gut. right? I have to fix my gut a lot because I have to take an antibiotic now and then because I have a chronic condition that I got when I wasn't well nourished and I was working in the ICU. So in any event, I wasn't nourished then. I was eating on the fly and I got a chronic infection. So every now and then I have to take an antibiotic and I notice a difference. It's terrible for my gut. My poop stinks. But normally it never does because it really doesn't. I can do a big one in the bathroom and not care if David comes in right after me because it doesn't smell. But that's based on diet and based on the microbiome in my gut. But when I take an antibiotic, I'm spraying. I hate it because I know that I'm killing good bacteria in my gut. So do I? Sure, I supplement. But in any event, it's more contagious because nobody is immune to it. Now, we're just coming out with antibody testing for COVID. And it'll take a while to get down to us, the little guy, but antibody testing will show us who is immune to it, either because they had an asymptomatic infection or they had a bad infection. And it will show whether or not you carry the antibodies for COVID. Now, if you carry the antibodies for COVID, you won't need a vaccine, right? Eventually, we're all going to have, there's going to be herd immunity. Now, I just saw in the news last night, this is fascinating, right before I went to bed. I'm super excited that a country has decided to do this because I'm excited to see what comes of this. But Sweden, and I'm not worried about them. I'm not worried about them because I feel like everybody has to do what they feel is right for them. But Sweden has decided not to do social distancing, and they have decided to decided to face this COVID pandemic with herd immunity. I don't know if anybody else heard that, but I find that fascinating. So everybody's still going to restaurants and everybody's still out in cafes because the weather is starting to get better. It's been cold there and now they're coming into a warmer season, and they are treating COVID in this way. And every country has a right to do what they want to do. Now, it's going to be interesting to see what comes of that. Right now, their numbers are very good. They're not testing a lot of people, and their numbers are still really good. I'm going to be following their numbers now that this came out. I'm going to be looking specifically at Sweden, and we're about to ramp up and get into our worst time, our 2 to 3 weeks now. So it'll be interesting to see how they fare as well. But herd immunity will eventually happen, and after herd immunity has occurred, okay, and lots and lots of people have been exposed to this, or vaccines will come out, and after people start getting vaccines, what causes coronavirus to still be bad, not increased contagion, but still bad, is that it has an overall mortality rate of 0.66. Now, overall is overall. That means from birth to 100-year-olds. There was a 104-year-old on TV this morning who got over it, and he just had his 104th birthday, and he was on the news this morning. They were celebrating him, and I think that's awesome. He looked great. He did not look 104. In any event, I'm putting my vagina down because I want to get some figures for you that I had written down earlier today. But the reason 0.66 is still astronomical is it's six times the mortality rate of the seasonal flu. So the seasonal flu is 0.05 to 0.1. So at the highest end of our seasonal flu, a 0.1% mortality rate, COVID-19 is 0.66. That's 6 times the mortality rate. And here's the other thing. It's worse, of course, as you get older. And that's the numbers that I wanted to tell you. So I have hospital rate those hospitalized with COVID, we've got 18.4% of them are greater than 80, 16.6%, 70 to 79, 60 to 69 is 11.8%, 50 to 59 is 8.1%, and it goes down from there. So I'm in the I'm 60, so I'm in the 11.8% group. Now, mortality rate is the same problem. That's just hospitalization rate. So mortality rate is the same. The older you are, the worse it is. So this is a devastating bug for our older population. Now, we have had at least one baby under the age of 1 who has succumbed to COVID. I have not heard as to whether or not that baby had some other comorbid medical condition. So that's why it's more contagious. It's 6 times more mortality, but it's never been in anybody before. So everybody has a potential of getting it, not just those who have never gotten the flu. All right. Okay.
Rhonda would also like to know, are there any supplements that you recommend to boost immune system for coronavirus?
Yes, and this is a good question because I want to clarify the difference between boosting immune system and fighting COVID. Okay, very important because we want to know the truth, right? You cannot drink enough water to flush it out. You get COVID, if you drink 4 of these a day, which I do, that will not flush it out. I saw somebody ask that today. Not my people. Okay, so there are a couple of very important supplements and that have been proven that are actually being used. And then hydroxychloroquine, I'm going to tell you how that works and why they think it actually works. So it will emphasize an important supplement. Now, first of all, if you're nutrient deficient, to boost your immune system, you need to supplement your nutrients. So if you're nutrient deficient, with a lot of people either can't eat as much food as they need to eat, so therefore they should take supplements, and that's probably where I fall. I eat the right foods, but I can't eat enough of them. So that's why I take supplements. And then there are people who eat the wrong food, so they're nutrient, deficient. So they need to take supplements and change their diet. Okay. So let's just pretend that everybody is not nutrient deficient, because that will boost your immune system in and of itself. I can't say that it won't prevent COVID, because it won't prevent COVID just by boosting your general supplements. There's no reason that I can think that we should say that will prevent COVID, because that scares me to say that, because then people will say, oh, I'll take my supplements and then I won't practice, not touching my face. And we don't want that. So yes, it will boost your immune system to get that. Everybody really, that's common sense. So let's just say though that we're at a baseline. What supplements will actually help with COVID? There are a few. Number 1, vitamin C. Vitamin C has been used in the hospital at reasonable doses. There are some proponents. They're usually the opposite. They didn't have conventional training, so they kind of did their own training, and so they think that if you take 50,000 milligrams of or 50 grams, I think there's some people doing 50,000 grams of IV vitamin C, that's going to magically cure it. Those aren't the doses they're using in the hospital. They're using 1,200 milligrams 3 or 4 times daily. They are using it by IV, which means it's going directly into the bloodstream. Doesn't go through your gut. So vitamin C has been shown to decrease the mortality of COVID patients who have COVID, vitamin C. So I don't know that it can help prevent it, which was your actual question, but I know that they're using it. So therefore, if they're using it in some hospitals, and they did use it in China and have had some success with it, then I would say it's also helpful for the other. Of course, I'm just saying that. There's no proof. We don't have any studies that proves it, but we do see that by using it in the hospital, people are doing better. The second one is zinc. Hydroxychloroquine works by helping zinc get in the cell. That's a super loaded statement. So many people are low in zinc, and you know, or probably have heard before, that zinc, for any time I ever, even just the slightest moment, start to feel like I'm getting a little bit of something under the weather, I'll pop some zinc for a few days. So, because I worry, uh-oh, am I getting something? And I, don't get anything except that chronic thing that I have. So the zinc actually is a huge immune booster. And so, viral fighter as well. So zinc is the other one. So vitamin C and zinc are two very big nutrients. Now there's a third one called quercetin. Quercetin is used heavily in leaky gut. Quercetin is a cell healer, just like L-glutamine helps the leaky gut. Well, leaky gut, leaky lungs, because it's the same thing with the lungs. What happens with these people is there's something called a cytokine storm. And for some reason, and it's not, just the elderly. I mean, I just saw this morning that an NFL player was in the ICU for 5 days. And this guy is a strong, healthy looking. He said he's healthy. He doesn't have any medical conditions at all. He was in the ICU for 5 days with COVID. So for some reason, some people get what's called a cytokine storm. So that brings in tons of fluid, because the cytokines come in, their cytokines are part of the immune system, and they come in to heal an infection. That's what they're there for, to heal an infection. But unfortunately, their body went overboard, and their body made more than their body can handle. So it came in at an aggressive rate and filled their lungs up with fluid. That's called a cytokine storm. So leaky lungs. So quercetin, which is also being used with vitamin C and zinc, is those are the three main supplements that have true. And I'm giving you what conventional medicine is using and known. And I think we need to stay in that arena, because everything else, I'm following the integrative people, I'm following the conventional people. And right now, since we have no knowledge of anything except either anecdotally or through some research that has been done in China, and research being done right now in the hospitals of New York that we're able to get through. We're doing lots of studies in New York right now on hydroxychloroquine. FDA pushed the use of hydroxychloroquine very, very quickly because they saw some improvement. Now, it's not helping everybody. If you get put on it, doesn't mean you're going to come out of it, but it's helping a lot of people. So I think right now, with so little known, I don't think that we can say, oh, this helped that coronavirus, so it'll help this coronavirus. That's where they're starting. But that's what we know. And I think that that's kind of the way I'm thinking. I don't want to go far out there and left field yet, because this isn't something that I feel we should do that with. Is that a good enough answer?
That's a great answer. Rhonda, let me know if you have anything else. She does have a couple more questions.
Can we give somebody else a chance?
Yep. We can answer some of those later. I have Michelle.
We're going to do this next Friday too. So and we can also have people send in their questions early. I can even do some videos to answer questions and put them up. But go ahead. So you have Michelle.
Okay, Michelle has 4 more questions. She She's been on 1 pump of the Hormone Heaven and 2 pumps of Hormone Protect, both morning and night, due to the findings of her spit test, taking Sundays off. She's done this for 2 years. She says that her old symptoms are coming back with month-long PMS and bloating and irregular periods, and she wants to know what to do.
Okay, and done that for 2 years. And Michelle, okay, so if so you've got a higher amount of, I see, okay, you needed more progesterone over estrogen, quite a bit more over, which means that you're probably premenopausal. And if that's the case, that you've been that estrogen dominant, there's two things that that come to my mind right off. There may be more later that come to my mind, but right off, two things come to my mind. One, you're not through menopause yet, so everything hasn't plummeted. So your progesterone drops faster and more than estrogen to start with. So that makes you estrogen dominant, and that's why you needed more progesterone. So if you haven't gone through it, and you've been doing this for 2 years, if you haven't gone through it, then things are still changing. And so if you haven't tested in the last 3-4 months, that would be, important to do, because things are constantly changing. And as you get older, you're changing. So symptoms, you may need to adjust that, decrease progesterone, increase estrogen. I don't know. But that would be my first thing, my first thought. So PMS symptoms all month long and irregular periods again. So yes, that would be the first thing is so with irregular periods again, so you're in that perimenopausal time, and that is when those hormones are fluctuating up and down, not progesterone. It pretty much stays, but the estrogen does have some fluctuations. That's a very, very good question, because it's the time that we are most vulnerable for ups and downs, because our hormones are fluctuating. We can keep them stable with our hormones, but we can't control the ups. We can keep them here, but we can't control when our own body throws out a bunch more estrogen, and it does. And it does this until you go through menopause. So about 2-3 years before menopause. So that's probably where you're at. So if you haven't had a test in the last, I'd say 3-4 months, I would do that. The second thing that I'm thinking that always, and as an example, and I shared with my group last night, Savvy Sister Circle, oh my gosh, I said, I was made to be stupid. And, I'm not stupid up here, but stupid decision. Like, I do things to myself that aren't always smart. And so Christmas last year, during the month of December, I had a really good time. While this COVID thing was ramping up in China, I was having a good time. That's what I think now. And I tell you, we had a great time with our neighbors. We had a great time with neighbors in Sarasota. Every time I turned around, I was having a great time. And I was drinking too much wine, is really the truth. And I wasn't sleeping as much because I was preparing for Squeaky Clean to Lean, and so I wanted to party and I wanted to work. So I wasn't treating myself well. I wasn't doing as what I should be doing. And I started having hot flashes. I never get hot flashes. And I'm like, what? So I realized what I was doing. So that just really irritated my cortisols, not sleeping, partying too much. And so I, cut it off, zip. And yours might not be that. You may not be being naughty like I was, but your cortisol might be elevated. So I would consider doing one with cortisol. The AccuMap 5 does not have cortisol in it. So so I would use either the Profile 1, I would use that, and I would always add estrone to it, E1. So whether you I wouldn't get the AccuMap 5, which is our kit, because it doesn't have cortisol in it. But for this one, because you were stable before and now you're not, let's see, whether or not your cortisol is messed up. If you really want to do a 4-point cortisol, you could do that too. Okay. All right.
We have Jacqueline that has been seeing several, it looks like, doctors, OBGYN, and they're telling her she doesn't have any physical symptoms, but she wants to talk more about why most doctors seem to be anti-hormones.
So your question is why most doctors are anti-hormones? Was that the question?
Yes. She's saying here that she's already been through early menopause, so hot flashes are gone. However, she's just wondering, she says, I'm thinking why not help supplement my system if I'm depleted of estrogen, because her doctors are saying she does not need hormones. So
I don't know.
recommend that.
I have no idea. I have a little bit of an idea.
Right?
Yeah, I have a little bit of an idea, but it doesn't speak well for conventional medicine. And I was conventionally trained and integratively trained, but it doesn't speak well for only conventionally trained. So I have to be careful about that too, because I love my colleagues. My colleagues are right now on the front lines. We love them. And we also, you know, I mean, it's kind of like an attorney, you know, nobody likes attorneys until they need one, right? Well, it's the same thing. We have to love everyone. We have to love everyone for how they feel about how they feel. It doesn't matter. We have to love everyone. And, you know, that includes politics, even though I don't like to speak politics. We have to love both sides. So, because that's really what brings the universe together. So, the problem, and the reason I think most of them don't want to go down the road of hormones is because they're not keeping up with the research. And I hate to say that, but it takes 17 years to get something down to the front line, which we're the front line. The doctors taking care. Your doctors are front line. So it takes 17 years to get it down to the front line. So in 2002, when the Women's Health Initiative was abruptly stopped by a director of the CDC, which my son works for, so I have to be careful about that too, because that doctor made me mad. What happened was he came out and announced that hormones cause heart disease, stroke, blood clot, and breast cancer, and dementia. All the things that, you know, women were like, what? I don't want any of those. So I'm just going to throw out my hormones. And they did. And doctors, now that when that came out, we had this massive media cover that, and massive hysteria pursued after that. But the problem is that all the research that has happened after that has not been followed by the media and has not come out. But just a few years later, when he came out, when his name was Dr. Russo, when he came out and said that and held this big press conference that the world watched, to me, in my opinion, he just wanted glorified attention. And so he came out and said that before the study was even evaluated by epidemiologists, carefully evaluated. He decided he knew what that study was saying, and he came out and said that. So everybody threw out their hormones, and doctors stopped prescribing it. In 2006, followed by 2007, followed by 2011, and followed by 2012, each single time, 2006, 7, 11, 12, proved that he was wrong. That the hormones, the synthetic progestin used in Primpro, caused increased heart disease, increased stroke, increased dementia, increased breast cancer. But the estrogen arm, there was a whole separate arm. There was an arm, two sections. There was an arm that took Primpro, which is Premarin plus that synthetic progestin. And then there was the arm that took only the synthetic, not synthetic, the estrogen from the horse, Premarin, horse's urine, pregnant horse's urine. Okay, that has 17 different types of estrogen in it that turn mostly to estrone. And even with taking the Premarin, with that crappy estrogen that most turns into estrone, even in that group compared to the control group, so there were actually the three. There was the control, there was the group that took the Prim Pro that had the Premarin plus the synthetic progestin, and then there was the group that took only the estrogen, the Premarin. This group that took only the Premarin had lower rates of breast cancer than the control group. 2006, 7, 11, and 12. It's just now making it to the front line. Keep watching. But you know what? It's hard to stay up on everything in medicine. And it's really hard to work with midlife women. I love working with midlife women because I am one, and I've been one for a long time. And again, the universe wanted me to suffer so I could help you. I love the fact that I went through a lot. And so that's why it's hard to work with midlife women. It's a whole lot easier to say you don't need it. Well, you don't need it if you want to increase your risk of heart disease, and you don't need it if you want to increase your risk of bone loss, and you don't need it if you want to increase your risk of dementia. Those are the medical conditions. If you want to maintain your hair, even if you bleach it, like I did, like stupid, still growing back. Yeah, I mean, lengthwise, because all this was off, to my scalp almost. So if you want all the other things, your skin, do I look 60 years old? I hope not. I get the gels, but we want to maintain our youth. We want to stay healthy. We want our retired years to be our best years. We want, we finally get that after working our freaking little fannies off. I'm not pulling out my rocking chair. I'm looking at the research, the literature, and it's just totally absurd. And it's getting there, I promise. If you go to the Menopause Society, the National Menopause Society, or is it international? I think it's National Menopause Society. They're now saying menopausal women, they need to take topical, not oral, hormones. It's getting there. So that's why, my love, it's easier to tell women, oh, if you don't have any symptoms, don't take it. Because there's another reason. Because they don't know how to prescribe bioidentical. We're not taught bioidentical. You got to go and do more training to do bioidentical. Who has time for that? Well, I made time for that because I needed them. So I'll tell you who I see in our classes, even our conventional conferences. I'll tell you who I see, the doctors, because we're talking about bioidentical hormones now in even our conventional conferences. That's coming out. But I'll tell you who stands up and asks the questions. The male doctors whose wives are menopausal. They're standing up and asking the questions. So I think that is really the reason why. Thank you for that question. That was
awesome. Thank you for that answer. That was great.
Okay.
Thank you for the question, Jacqueline. I'm skipping around a little bit because some of them are going to be a little complex, might take a little bit longer, so we might want to save them for the next session. But Kathy would like to know about silver spray. Do you suggest it, and how often?
Yeah, colloidal silver, I bet you're talking about. I love colloidal silver for many things. I sometimes nebulize colloidal silver for a chronic bacteria that is in my lungs and will be in my lungs forever. Very, very well controlled. So if I need to, I will nebulize it. I used to nebulize it a lot when I was sicker, but now I don't have to. But topically on wounds, orally. You can consume it orally. I use a Silvercillin. I use a colloidal silver. It's 5 milliliters. I do take consume that, and you could take it orally. I would be careful with the colloidal silver. Just make sure that it's a pharmaceutical grade, and it's coming from a company. It's the same thing with taking hormones. Don't take Walmart brand hormones. And, like if you go and get DHEA or pregnanolone, the over-the-counter hormones, don't take a pharmaceutical grade. They're not expensive, and you want to take it from a pharmaceutical grade that is a company that has a lot to lose if it has heavy metals or toxins in it. You want to know that it's being manufactured here in the United States by a GMP facility that is FDA monitored and controlled. So we're talking we're talking colloidal silver falls in the same range, especially if you're going to be using it internally. So what was the question again? Sorry.
Just talking about the silver. Dosing. You did talk about dosing.
That's really very complicated, dosing. And the reason is because there's colloidal silver that is attached to protein and colloidal silver that is not attached to protein. So when you go to, say, the health food store and you see colloidal silver, you'll see 500 parts per million in one of them. And then you'll see 50 parts per million or 30 parts per million, right? And you're like, oh, this 500 is so much better. That's scary. Not because it'll turn you blue, because that's really a rarity. So the side effect of people who make their own colloidal silver, if it's not carefully made, will turn your skin blue. There is a guy, he got popular because he made his own. I think he lived out in someplace rural. He made his own colloidal silver and it turned his skin blue. And once that happens, your skin is always blue. So they call him the Smurf man. But here's the other problem. The 500 parts per million or 250 parts per million, that is not what you want, because the only way that you can get 250 or 500 parts per million or these high parts per million is to attach it to a protein. Now that's dangerous. If you're only going to use it, I guess, orally, the stomach is amazing. It's got massive amount of acid in it, and you can eat some pretty bad stuff and the acid kills it. But protein, anytime something it's attached to a protein, if it's attached to a protein, it has a risk of getting contaminated. So every time you open the bottle, right, if it's not sterile, every time you open a bottle, you can potentially get something in there. So I do not recommend any colloidal silver that attaches to a protein. Now, how do you know? That's hard because they're tricky about whether or not they tell you that it's attached to a protein. The only way you can get 250 parts per million is for all those silver particles to be attached to that protein. And they won't tell you that. You have to, be savvy about this. So here's how you tell. Colloidal silver should actually not be dark. It should not be dark. It should be clear. Okay, it should be clear. And so anytime that you get one that is dark, which most of them are, that's attached to a protein. So I would just either take that back or just buy a good brand to start with. How's that? The other thing is if you happen to nebulize it, so, I do have people nebulize colloidal silver. A lot of my elderly patients who get pneumonia easily, now we're not getting pneumonia very much anymore since we've been in lockdown, I'll have them nebulize colloidal silver. But if you nebulize a colloidal silver, or spray a colloidal silver. If you shake it, that's the other way. If you shake it and foam forms on it, it's got a protein in it. The colloidal silver's attached to protein. It should not foam up. Okay.
Awesome. Here's another one. How often should you test if postmenopausal and on hormones for 3 years?
What a great question. Once you're postmenopausal and you feel stable on your hormones and you feel good, I generally say once a year from that point out. Though I'll have to admit, I have neglected that myself at times. I did test after I got hot flashes in December and found it to be really my habit that I was doing. Once a year is enough if you're stable. And if you push it a little longer than that, that's okay too, as long as your levels were good when you tested and you didn't change anything. Because once you're menopausal, everything that you take is related. I'm seeing my battery low. I'm gonna see why. I must, excuse me, 1 second. Oh, there we go. Yeah. So once you, I just dropped my uterus. So once you test it, and after the first time, so if it's been 3 years since you tested, I say it's time. And then every year is enough, as long as you don't change your dosing.
Great. Shelley, thank you for that question. And looks like Dolly, maybe. She is asking, my labia is dry and grouchy. Could you recommend something or manufacture something to soothe my labia? The dryness really irritates my inclusion. Hopefully I'm saying these right, sis. On the pregnenolone suppositories.
Could you give me the name, the first name? Ask the question.
D-A-L-E. Is it Dale or Dolly? D-A-L-E. Submitted at 12:38, it looks like.
Okay, yeah. Okay, I see it. My labia is dry and grouchy. Could you recommend something or manufacture something to soothe my labia? The dryness really irritates my inclusion cysts. So inclusion cysts are little cysts that can form up inside of little glands that help secrete our natural juices. So these inclusion cysts actually prevent her from secreting fluid that she needs to secrete. We secrete less of it, but we can still secrete. And so she's on the pregnenolone suppositories, miss the DHEA ones. Yeah. Okay, so I'm surprised that you're missing the DHEA ones. I am totally on only the pregnenolone. I find it to be far more effective than the DHEA ones. And most of the people that I have received emails from have told me the same thing, that the pregnenolones are actually working better for them than DHEA, and that's why we went up the chain. So pregnenolone, excuse me, makes DHEA, but it also makes the estrogens and which also makes the testosterone. So it's 3 hormones that we know support in 3 different ways, support the vaginal tissues: estrogen, testosterone, and DHEA. So by going up the chain to pregnenolone, it makes all 3. So that's why we did that. And I have been having most people I haven't had anybody tell me otherwise, that they're missing the DHEA. There is a DHEA suppository. If you feel, now I'm not making it anymore because we went up the chain, but there is a DHEA suppository that is called Intrarosa. It's a prescription. It's kind of expensive, but it is available, and maybe your insurance would pay for it. I don't know. But with the pregnenolone suppositories, or even the other one, I mean, I generally say if you're still sexually active and you're not a planner about when you're going to have intercourse with your partner, then, and your partner is a male, then pregnenolone might be better for you, because the pregnenolone is good for guys, whereas the estriol one, you may not want to subject your male partner to that. But uh, the base that the pregnenolone is held in should be moisturizing the labias. And if it's not, I question how frequently you may need to use it. On average, it can be 3 times a week to every other day. So if it's not moisturizing already, the outside of the labias, does she say how frequent she's using it? No. So if it's not moisturizing the outside, because some of it, after it heals the inside, as long as you're using it enough, it's coming and you get that moisture on the outside. You remember those years when we were in our 20s and 30s, and our underwear would get like a stain in the crotch area. I used to get so annoyed by that. Well, it's good. That is a good thing. We want that moisture on our underwear. We want to see that moisture on our underwear. But as we get older, we don't see that. Our underwear is dry, especially if you had a hysterectomy, right? Or your ovaries out, because then you have pretty much no hormones. You're not making anything except what's in your adrenal glands, and your fat cells conversion to estrone, which converts to estradiol. So depending on size and fat and whether or not you had your ovaries out, depends on what your hormone levels are. That's why we want to test in many cases. So if you're not seeing any streaking on your underwear, that's another indication that you may not be using it enough. There are some other topical things that you can put on there. There's topical things to help soothe it in the meantime. If you're not moist on the outside, though, it means that you might not be moist enough on the inside. So first, I would definitely say you may need to increase how frequently you use it. But the second thing is that there are other products that you would use only on the outside, not on the inside. And those are good products. There is something called Emu Aid, EMUAIDE. That's a really good product that you can use on the outside. There's two strengths. You start with the lower strength, and then that one I would highly recommend. It's made specifically for that area. That's the other thing I want to say. Make sure you use something specifically for that area, because a lot of products might have something in it that isn't good for the area, that could irritate it more. Okay, what else, my
You've
love?
got one more, and I've copied all the questions back and have a backup. So if there's anything that we didn't get to, we will. Well, we've got one that I think will make our last one. It's
And
from
I'd also, before that, we want to also make sure everybody gets access to our free gift that we have for them today. And also, I would like people to put in the message if they got something out of this, and if they, I'll be doing them next Friday, but if they like this, if this is something that spoke to them, if they feel they would benefit from me doing more, and even after COVID is over, because it's going to be over. People, it's definitely going to be over. So if you would do that for me in the message box, that would be really helpful. I appreciate it.
That would be awesome. And I'll be sending out the free gift when we're done. So everybody
Good.
will be able to get the link to that.
Okay, great.
So Nina loves your skin. She would like to know if your youthful skin is from eating right and balanced hormones, Or do you have an anti-aging skincare regimen that you'd like to share?
I don't have an anti-aging skin regimen. I was born and raised in Florida. I was a sun worshiper. I grew up in the time where we competed to see who got the darkest skin. My brother and sister, one of my sisters, and I would compete, and we would slather on. We'd go to New Smyrna Beach all the time. And in high school, oh my God, we lived at New Smyrna Beach over the weekend. And back then, we didn't have cell phones, so we got by with murder. Oh, Mom, I'm spending the night with so and so. We just stay at the beach. And so we would slather on the baby oil, so we never used anything. So uh, that I stopped when I probably got about 40 years old, because no, I'm going to have to say I stopped that at maybe 35, because that's when I went to med school. I went to med school later in life at age 35. And then I didn't get to go to the beach anymore because I had to buckle down. But in any event, so I don't have an anti-aging, except that I will say that I do drink. This is 27 ounces. I think that when I don't drink my water, I'm almost done with this one. I'm very, very thirsty. But I actually bought these glass bottles because you don't want to use a plastic bottle in your car. You don't want it to get heat. You don't want, I don't drink plastic bottle stuff. They're not BPA free plastic bottles. And some of you have other bottles that are not BPA um, uh, bottles. And those are just as good. But the reason I picked this is because they're glass, and I bought a whole bunch of them, and I just refill them with filtered water because they're expensive. So I just bought an initial amount. I also like to use this because I like to measure things. I like to know what I'm consuming. So every day I have a nice size serving of nuts. And so nuts are very, very high in calories. And so I know serving sizes of everything. I don't measure things out now because I measured it in the beginning. This was 27 ounces. So I have to drink 4 of these a day. Sometimes, and so I know what I need to do, right? It's so easy. So when you know that you should drink, say, X amount, then you figure out what kind of bottle you want, and then you stick to that. So I have 4 of these in the refrigerator when I wake up, and I start and drink them until they're done. So that's one way. And I do think that fluid, I mean, we're mostly water. So I do think that water, I don't drink tea anymore, except on a rarity. When David calls me, he's out, and he'll say, "Hey, you want me to pick you up an iced tea?" And I'm like, "Yeah, yeah, yeah." But I do think that hydration is critical for our skin. And um, when I don't, when I miss, I will wake up with some like puffiness under here, and you know, you would think, wait a minute, how can you have puffiness? That's more fluid, right? Well, the body's retaining fluid because you don't have enough. So the body does what it needs to do in order to protect you. So if it says, "Hey, you didn't drink enough water," and it starts, you know, pulling it back, and it'll collect in different areas. So I think water is a secret. I do have one of those rollers that I love, and I used to not moisturize at all, but I do now because I'm older. Particularly, we can't forget our necks. I have a chicken neck. I have a chicken neck, always have. But we don't take care of our necks, and so the necks get, I don't wear sunscreen, I have to be honest, but I'm not in the sun much anymore because either, yeah, I'm working, so I'm not in the sun anymore. But I also believe that the sunscreen that people are told to wear by conventional dermatologists can, putting that on every day can be harmful. So I think we need to protect our skin other ways than using those sunscreens every day. We can talk about that. I'm backing off a little bit because I don't want anybody to get mad at me for saying that, because it does decrease wrinkles if the sun doesn't get to your skin. There's no doubt. But if you look on those sunscreens, if you look at the chemicals on those sunscreens, and then you go and look up those chemicals on the Environmental Protection Agency, or what's it called? Environmental Working Group, EWG. If you go look it up, they have a wonderful site, Environmental Working Group, and you can go to their skincare part of their website and look up those products, and it's kind of scary. I don't want to be absorbing those. Remember, your skin is your largest organ, and so you're absorbing what you put on your skin. So I don't have a regimen, which reminds me of when I was in my 20s. I saw this woman who was much, much older than me one time that I remember working at the post office, and I saw that she was much older than me because she had gray hair. I was in my 20s, and she had this most beautiful skin. And I said to her, what do you use on your skin? Because it looks really pretty. And, I thought she was going to tell me something, like, whatever, something on TV, right? She said, oh, I just use soap and water. I mean, I just use water. And I'm like, what? You just use water? You don't use any soap on your skin? Oh, Lord, no, I don't use soap on my skin. I said, so you don't use any of those creams or anything like that? Nope, I just use water. So everybody's different. If I just use water, I'd have pimples all over the place. And I don't really think that, that would work for me. But so I think that it's hard to say what could work for everybody. I think that everybody is different and we have different genes. My mother has a lot of wrinkles. She was a sun worshiper too. She's just loaded with wrinkles. And my dad died last year at the age of 98 and hardly had any. So it's a possibility that that was really helpful for me, that I got my dad's skin. And then if you think of Christy Brinkley, oh my Lord, that girl, her mother, if you've ever seen what her mother looks like, whew, her mother is gorgeous. So there's got to be a little genes there. But hormones definitely keep our skin younger, just like it keeps our hair younger, because our skin has a lot of collagen in it. And estrogen, without estrogen, our collagen breaks down. That's why menopausal women often have joint pain, because collagen is critical for our joints. So my orthopedic doctor, I got frozen shoulder. I can't even remember which one it was, but I had it in one of my shoulders where I couldn't even move. I thought I had hurt it. And I went to go see him, and he said, are you hypothyroid? And I said, well, yeah. And he goes, well, are you menopausal? And I'm like, well, yeah. And he said, well, we know that women who are menopausal have higher rates of frozen shoulder because of low estrogen. And I'm like, holy crap, you're kidding. Okay, well, I'm going to up my hormones. And I had to do a lot of therapy, self-therapy. It's completely resolved. And, I did have a little bit in the other shoulder, but in any event, I do think that that plays a part as well. Collagen. Okay. Okay, so are we gonna say, now you said that you wrote down all of the questions,
I've
Yvonne?
got all the questions, yes. And you've got a lot of thank yous and knowledge is power and love this. Please continue to do it. This is wonderful, Dr. Leggett. We appreciate your passion about helping us all. So
Thank you.
lots kudos.
Okay, love to you. Kudos to you for being here because we went 2 hours and that's how long I put it. I didn't know if it'd be an hour, hour and a half, 2 hours. So you want to join me again next week? I'll see you here at noon on next Friday. Not sure if I'll be in Trenton or Sarasota. We'll see. And either way, I look forward to seeing you again and answering your questions. And these questions that are we didn't get a chance to answer will be great. Maybe I can answer some of those and put those in Facebook. I won't mention any names, obviously. That's crazy. Won't do that. And so take care, stay well, and love you guys. And thank you for taking care of yourselves and your family, your parents, your children, grandchildren, yourself, your partners, and partners, everybody. And love you. Thank you for being here. Thank you for being the amazing women that you are. Bye-bye.
Thank you, Dr. Karen. Bye. Thanks,
Bye.
everyone.
Bye.